Okay, so today's notes will be discussing Medicaid. Medicaid is a very sensitive topic that's been going on in the country recently. And first and foremost, Ivory, I want you to kind of explain to the people what exactly is Medicaid, because I think a lot of people hear Medicaid, but they may not know exactly what it is. Can you go ahead and break it down for the people?
Yeah, so in basic terms, Medicaid is health insurance for people who cannot afford it. Or if you don't have the money to afford it, let's say you don't have a job, you don't get insurance from your traditional employer, you get into an accident, who gonna pay for that? Who That's like a safety net. So it's a safety net for millions and
And
millions
millions.
of Americans. So 24% of Americans are actually on Medicaid. That's a lot of people. That's tens of millions of people. So my thing is very important safety net because man, like imagine getting to a car accident and you don't have health insurance and you get sick or something like that. You don't have health insurance. Who's gonna pay that bill? I
Yeah.
mean, the taxpayer's gonna have to pay that bill anyway. So that's a little quick explanation of Medicaid.
Now, obviously, I've been hearing a lot of people saying that they're going to do cuts to Medicaid. So, my question to both of you guys is, what do you feel the ramifications are going to be if something like that were to take place?
You mind if I say something real quick, Irie?
I've had
It's
it,
really
bro.
it's really the one big thing. I think it's weird because I remember I was watching like anybody watching YouTube or Tone Talks. I think he had a video. He talked a little bit about this, and this is how it's going to impact Black families. Okay, let's say, hey, you know what? You were dating somebody, married somebody, didn't work out. Cool. Y'all break up. Let's say y'all income wasn't the best. You're trying to figure it out. So you pay child support, whatever the case may be. And then the kids might qualify for Medicaid, right? The kids may qualify for Medicaid, right? So yeah, you may pay $500-$600 a month, $1,000 a month. It's a lot of money, right? But at least the kids got health care through Medicaid. If that gets cut, right, there's a chance that they may not have Medicaid, right? Now they got to have health insurance. So now, if you pay child support, that 600 might be 1,100 now because you got to pay for, you got to get health care somewhere, right? So I think it's going to impact families in a way that like a lot of single parents, a lot of young couples who don't make a lot of money, have are on Medicaid. I'm pretty sure I got little cousins on Medicaid. You know what I'm saying? I'm pretty sure a lot of people got nieces and nephews on Medicaid. So I think what it's going to end up doing is that it's going to raise the price and it's going to drive up the expense of a lot of people who have to find alternatives, what I'm saying, to healthcare and probably pay for healthcare that's even less that offers less protections than Medicaid, but have to pay out of pocket for it and pay way more money.
Yeah, let's be blunt about it. A lot of people are going to die without getting care. They're not going to have access to care because it's already underfunded. Medicaid is heavily, heavily underfunded. And you talking about making more cuts to it? Come on, man. I can't get with that. I don't see any type of way. I think there's other ways to get cuts. I just don't understand why would you touch this when so many people need Medicaid, so many people rely on it, so many people, 40% of children in the United States
Yeah.
are on Medicaid. Like 65% of the of red states are actually benefiting from Medicaid. So a lot of people, this is millions of people. Like I said, I'm not on Medicaid. I don't need it. It's not a need that I have. When I was a child, I was on Medicaid. It was a life support. It was helpful for us to have that where we can go get our checkups and our dental, things like that. So you talk about removing that. I tell you what, man, I think that's gonna sink Trump's poll numbers. One, and you want to be the most popular president. I mean, hey, you got to get the Medicaid going, man. You got to get that going, President Trump. So my thing is that I don't want to see that cut. I don't want to see that cut to go to some rich millionaires to pay for their tax cuts. Because if that happens, man, I think that's just you can kiss everything goodbye in this country where we literally value profits and money over people. And that's exactly what's going to happen if you take if you cut from Medicaid to fund tax cuts for the rich.
Well, playing devil's advocate, and I'm just thinking of some things that people may say to push back. Well, everybody says, big pharma and big medicine is, they're overcharging people and this and that, and we're taking profits away from them as far as this program. I mean, what's your thought process as far as people who would think would approach it that way? Is, well, doctors and all these people overcharging people as it is, so this is taking it away from putting money in their pockets ultimately.
Yeah, so that's not a Medicaid issue. That is an administrative issue. That is an enforcement issue. That doesn't change the fact that people who can't afford care needs care and has access to care. Like that's totally two different things. I think we need to decide in this country what type of people that we want to be. Do we want to be people who literally see people dying on the streets, don't have health care, homeless, drugged out, in situations where they feel like, man, I can't even afford to go to the doctor because I'm gonna
Uh,
get a $500 bill, $1,000 bill? Or do we want to be a country to say, you know what, we're going to take care of our own, and part of us taking care of our own is making sure that we have people have access to health care, which is to me, I believe, is a basic human right. And so my thing is, okay, if we got issues where people getting overcharged and those things, that's a separate issue from actually giving people access to care. Those are two things, different things in my book.
True. And if all lives matter, you should want all human beings to be healthy, especially United States citizens. If all lives do matter, take it.
Oh, for sure.
So, all right. Well, wanted to thank you, gentlemen, for giving your insight on this topic for today. Appreciate everybody for joining us. We want your feedback. So, anything that you feel as far as your stance when it comes to Medicaid, go ahead and comment below. We want feedback from any and everybody who's willing to give it.